no cough or tightness of chest or fever. They are asymptomatic, but the reports are saying that you can be asymptomatic and still be contagious. And so the purpose of the face coverings is not necessarily to protect yourself, but it's to protect others from getting something when you're asymptomatic. You know, I don't have a fever, I don't have a dry cough, I don't have tightness of chest, but that doesn't necessarily mean that I cannot be contagious or infect someone else. So the purpose of putting, it could be a cloth, I just call it a facial covering, and then we're going to do everything that we can to try to make these face coverings of these masks available, especially to our vulnerable populations like our seniors, people with diabetes, hypertension, so that they can have it. But in the meantime, if you have a handkerchief or a bandana, any sort of facial covering, that will work. As long as, you know, we're trying to save these N95 masks, for example, surgical masks, for our healthcare providers and first responders. Now, let me give the latest report for today. The number of the count that I'm getting from the Health and Human Department today is that our count has increased by 103 people who have been diagnosed with COVID-19. That brings the Houston count. This is the Houston count to 690. And so, and then it's my, I hate to announce we have one more death, and so our count has gone from 8 to 9. And we certainly want to extend our condolences to all of those who have lost their lives as a result of COVID-19. The person, the 9th person that has died in the Houston area was in his 60s with underlying medical conditions. So we want to do everything we can to reduce the number of people who are infected with COVID-19. We want to do everything within our power to keep people from dying as a result of COVID-19. And so, again, asking people to continue to engage in social distancing, to stay home. If you go out to the grocery stores, to the parks, wherever you may be going, to just be mindful of engaging in social distancing, because that is what, in the end, is what's going to help to bring us out of this situation and for us to get back to some normal life as quickly as possible. So let me thank people for complying. I've been driving around the city of Houston today, riding around and looking and kind of assessing where things are. The weather, of course, is helping to keep the traffic low, and so I want to thank God for that. But let me thank everyone for what you're doing. Now, the Houston Food Bank is critical because there are a lot of people in our region, in the city, in the region, who are unemployed, been laid off. They're not receiving a paycheck at all, and so I'm equally concerned about the food insecurities that exist. There are a lot of people, low-income individuals, seniors, and others, children, that need to eat. They need nutritious food. That's very, very important. And I want to thank the Houston Food Bank for just being an awesome partner. If you want to think about it, some place where you can contribute or volunteer, there's no better place than the Houston Food Bank. And they are operating 7 days a week and running pretty much 23 hours a day. 23 out of 24 hours. The number of their volunteers has gone down because of this virus. And so that's why we want to make sure, for example, we want to make sure that their volunteers are safe. And so for their volunteers and for their employees, if you have any, facial coverings, masks that they can utilize for their volunteers, let's remember the Houston Food Bank, because they're the ones who are preparing these meals for our seniors, for our children. They're supplementing our school districts, for example, in their food distribution centers. They're providing meals and food to a lot of the outlying areas outside of this building. And so let's remember them. You can either make a financial contribution to them. That would be helpful. You can continue to provide the dry goods, the canned items, perishable items. That's very, very important. Volunteers are important, and we want to make sure that the people who are coming to volunteer, that you have those masks and those things that are needed to keep you safe and to keep others safe as well. So let me just stop and let me bring up Matt Toombs. And Matt, thank you. I know Brian Green runs the Houston Food Bank, and he's not here today, but let me thank you and for what you're doing. Kind of give us an assessment of where things are.
Oh, absolutely. Thank you, Mayor. I appreciate it. So, absolutely, everything that Mayor Turner says is absolutely correct. We are open and accepting volunteers. We are doing everything we can to ensure the volunteers that come in are social distance, and we are testing temperatures as they come in, just to ensure that we can maintain a safe volunteer experience. The reason volunteers are so important for us is for us to glean through and transpose food from palletized or unsorted food into a box that can be consumed is essential for us to operate. The demand is in the community. We want to meet the demand, but unfortunately we need people to help us do that. So we appreciate Mayor Turner and him helping us get out into the community and get more people in to assist our food distributions.
Thank you. So let me just say again, and I know I've said it many times, I don't get caught up in the numbers. 103 cases that we're adding today, bringing the Houston count to 690. We're doing more testing, so more people are being tested in Houston, more people are being tested in the region, and so I fully expect those numbers to continue to rise until we reach our peak point, which could be somewhere towards the end of April, first week in May. Somewhere up in that. I think that's what the medical professionals are telling us. So on every day as we go forward until we reach that peak point, I'm expecting the numbers could be anywhere from 80, 81, like on yesterday. Today is 103. It could be 125. As we do more testing, I expect those numbers to rise. But what's important is not the numbers. It's the healthcare delivery system ability to handle the patients that need to come into the hospital, or the patients who are in the hospital that need an ICU bed. That's the key, trying to manage their capability such that the numbers do not overwhelm our healthcare delivery system. And that's why we keep talking about flattening the curve, slowing the progression of this virus. Though that's the critical goal. That's the objective of the social distancing, putting on these masks. And I can tell you, they're not quite comfortable. You know, I can tell you that. I would rather for you to see my glowing face and my smile, but you know, it is what it is. Especially when we're out, when we're going about in the community. So let me thank people for just enduring the inconvenience. Let me thank you for enduring the inconvenience. But what I do know is that when we work together, we can achieve the goal of flattening the curve, blunting the progression of this virus, doing everything we can to stay within our healthcare delivery system ability to handle the cases. And every day we can do that. I just count that as a victory on this particular day. So let's take it one day at a time. Let's not look and see how long this will be, but let's just focus on taking it one day at a time, and then we'll get through this.
Question from KTRK. Are you concerned about nursing homes in Houston? What happened in Texas City? And second part of that, are there any areas in Houston that you're concerned with clusters of positive COVID?
Yeah, I'm concerned about any areas where there's a cluster. Nursing homes, we've been talking about nursing homes for the last 30 days, quite frankly. And we've said to individuals that if you're traveling don't go to the nursing home. In fact, minimize you're going to the nursing home. I know we have our loved ones at nursing homes, senior living facilities, but that's a very vulnerable population. And so very much concerned. We've asked the nursing homes, for example, in city of Houston, our region, to make sure that they have their own safety plan, you know, and preparedness plan, but very much concerned where there's any cluster. And so we're focusing, for example, like on the homeless population in our shelters. We're taking steps. We'll be taking steps to kind of thin that population out. That's one of the things I've been doing today, kind of touring our homeless populations, concerned about that. but any place where there's a large cluster. And that's why, even with regards to our faith-based institutions, we recognize that people want to gather for their places of worship, but we're asking people to go online and do it that way, because if we cluster too much together, then we only increase the chances of people being infected.
Now that everyone's been asked to wear masks, you kind of touched on it. Is the city, are you guys kind of shifting the supply, or how are you going to handle it now that everybody?
Yeah, we're doing as much as we can, you know, and again, you don't necessarily have to have this type of mask. This is, I call it more of a facial covering. It's not an N95 or a KN95 or a surgical mask. It could be a soft cloth. It could be a bandana. It can be just in case, you know, this one doesn't work, you know. I carry around my extra handkerchief, you know. The whole key is to to cover your mouth and nose, for example. So, and it's not so much to protect you, the person. Now, this is not so much to protect me. It's to protect somebody else in case, for example, you know, you are you do have the COVID-19, but you don't have any symptoms. And with this particular virus, it's not like the flu. You know, you can pretty much, you know, people sneezing, coughing, and all of that, not feeling well. But you don't have to have a fever. You don't have to have dryness of the fever, the tightness of chest. You don't have to have any of that. But that doesn't mean that you're not spreading it. So you can be asymptomatic and still spread it, and that's the purpose of at least covering your nose and your mouth.
Last question. You kind of touched on the church services. For those people who are just going to show up, they're going to go to church anyway, what's your message to them?
Well, my message is that, you know, this is one time where you don't just necessarily think about yourself, but think about others as well. And the reality is you may be okay, but you don't know whether or not you are walking around with it. You could be asymptomatic. You could feel fine. But that doesn't stop you from giving it to someone else. So, you know, I encourage people to exercise common sense and good judgment. I just believe that God hears me wherever I am. I could be at home and pray, and God will hear my prayer. I can be at home and worship, and God will respond to my needs. It's not, my faith is not necessarily dependent on a venue, but it's what's in my heart, my mind, and my soul. So I let people make their, you know, you can make your judgment. I certainly have the utmost respect for our faith-based community and for people of faith. And so I get it. I know it's a very difficult choice. And as we say all the time, we're going to do our part. God will do the rest. But I had a pastor, an older pastor, who used to say all the time, God feeds the birds, but he won't throw it in your nest. At some point, you got to get up and get it. So God, yes, he is omnipotent, and he's everywhere. But he also expects us to exercise some good judgment ourselves, you know. So I hope people will govern themselves accordingly based on what we're asking them to do. And I want to thank them. And I do want to continue to reiterate that what we are asking of you and what people are doing is working. It's working. Even though the numbers continue to rise, still, but for what we are doing, the numbers would be so much higher, and so many more people would be in our hospitals. And you need only look at New York or New Orleans. And bear in mind, in the city of Houston, we are the 4th largest city in the United States. The 4th largest city. People are talking about New York City. They're talking about LA. They're talking about Chicago. But at this point in time, they're not necessarily talking about Houston. Now, that doesn't mean that 2 weeks from now, we couldn't be there. But to a significant degree, we hold our destiny in our hands. And while our numbers still, relatively speaking, are low in comparison to other places, let's not take that for granted. And let's not assume that we cannot be a New York City or Chicago or New Orleans. So let's be prudent. Let's endure the inconvenience, and then in due time, as my mom would say, this too shall pass. Okay? Thank you all so very much. Okay.
Very well put.
Thank you.
I know. I want to shake hands.
I want to do it. I want to do it.
Amazingly put. Thank you, Mayor. We appreciate it. Thank you for spending time coming out. I know you're busy. Coming out and giving us a hand, and it means the world to us. Thank you.
Thank you so
much.
I appreciate it. This is a jewel for us in the city of Houston. So, and that kitchen is amazing.
Yeah. By the way, did you know that it's the largest fruit bags by distribution in the entire country?
I did not know that.
By a lot.
We're the largest by distribution?
We're the largest.
Mary, did you do that? The Houston Food Bank is the largest.